All right, so let's talk about labor and delivery. Okay, so what we are looking at here is that the woman is now pregnant, right? So from the last menstruation to labor and delivery is about 9 months. Okay, so now it's time to deliver the baby. Okay, so we're going to go through labor and delivery. So this is a pretty significant part of a nursing career or some other healthcare profession because of the number of babies that are born. There's whole floors dedicated to prepartum and postpartum and also labor and delivery. So becomes an important part of nursing education. So I want to go through what is going on in the labor and delivery pathway. So we'll look at this pathway. Okay. So that's the pathway for the augmentation of labor. So how does labor progress? Okay. And the pathway that starts this is that you have the hypothalamus, posterior pituitary. Okay. We haven't talked about the neurohypophysis for a while. It's going to come in right here. So it's the posterior neurohypophysis. And then we have the uterus, but really we're looking at the myometrium, which is the muscle part of the uterus. So there's many things that can start a labor. A labor could be induced and the water could break and that can start a labor. A woman can start feeling contraction. And so there's a number of things that start labor and delivery. I'm going to start with the contraction just for the sake of starting somewhere. So something will cause the myometrium to start contracting. And it's mainly when the baby is ready to come, the contractions will start. So these are the real labor contractions, not the Braxton Hicks contractions. So the contraction will have to signal to the brain that, oh, this is going to be labor and delivery. Right? So this is real. The baby's coming. I'm going to tell the brain the baby's coming. So this signal is sent to the brain and to the hypothalamus. And this is sent as a positive feedback, not negative, positive feedback. So the positive feedback that goes into the brain, to the hypothalamus, is telling the brain that these contractions are going to be the delivery of the baby. What the positive feedback does is that it's going to send through the brain the hypothalamus, and the hypothalamus is going to send a neural signal. It's not hormonal, it's neuronal, to the posterior pituitary, neural hypophysis. Okay? And the posterior pituitary has stored a number of level of oxytocin. So the oxytocin is going to be released, oxytocin, into the blood. The release of the oxytocin into the blood will then bind to the receptors on the myometrium, which has the oxytocin receptors. Okay? So these receptors start becoming expressed in the 8th month of pregnancy, so towards the end of pregnancy. So oxytocin will bind, and when oxytocin binds, then the contraction will increase. So as the contraction increase, the signal back to the brain is going to say, okay, well, let's ramp it up. The baby's coming. So now that increases the signal to the brain. Then the hypothalamus sends higher neuronal signal to the posterior pituitary. And then that sends even more oxytocin. And then more oxytocin leads more contraction. And the whole thing gets stronger and stronger until the baby's ready to come out. So people who have gone through labor and delivery might have remembered that happening. Okay, so you can look at this whole pathway. Okay, so that's augmentation of labor. There's a medication called Pitocin that's given to patients, and Pitocin is essentially oxytocin. So if a woman kind of stalls in a labor, like it's not progressing, an IV of Pitocin can be given to artificially increases, and then that will increase contraction and ramp up the labor. Okay, So one thing that a lot of students don't understand what contraction does is that a lot of people think contraction is what pushes the baby out, right? It's not going to happen if the cervix is not open. So here you can see the cervix is fairly close. It's undilated. So the purpose of the contraction is, here's the myometrium, right, of the uterus, highlighted in green here. So as the myometrium contracts, it's pulling. So if you watch my hands, pulling on the cervix and stretching it up. So as you contract, it is pulling and thinning that cervix off to 10 centimeters. So this is why you might have heard a lot of people say, as much as contraction is a painful process, it is also a relaxation process to let the body do what it needs to do. So in some ways, like when I went through labor and delivery, I really focus on that the stronger the contraction, the more dilation you're going to get. And if you don't get from here to 10 centimeters, the baby cannot come out. Okay, so then a cesarean has to happen. Okay, so that is very important in the stages of labor. In fact, this is the part most people think is the birthing process that's the most painful. In most cases, and this stage 1, the dilation of from here to 10 centimeters is the most painful. Usually it's like from 3 to 6. From 3 to 10 or 6 to 10, that is when the strongest contraction is going to happen. Okay, once you're at 10 centimeters, the baby is ready to come, and that's stage 2 of labor. And in stage 2 of labor, the head is not able to fit through the dilated cervix, so the baby cannot come out, okay, of the body with the umbilical cord. Okay, so that's the birth of the baby and the delivery of the umbilical cord. And after delivery of the baby and the umbilical cord has been tied off, then the mom will then deliver the placenta. So after the delivery of the placenta, you can see here, what happens is you'll see that the hormone will drop from up here to nothing because the placenta is no longer producing the HCG, the estrogen, and the progesterone. Okay, so that is the birthing process and the birthing, how all the pathway works and the hormones involved. Okay, so that is labor and delivery.